Hello guys, this is Myka TV and the house or in the hospital, and I will going to showcase the different kinds of instruments that's for sterilization process. So now, as you can see, this one has finished the washer disinfector, um, automatic washer disinfector. So I'm going to remove all the instruments inside. As you can see, this one is so hot. I can touch it barely with bare hands. So I'm going to use the thermal gloves so my hands will be protected. And right now, it will be gonna be for a couple of minutes. So just stay there. And if you're not yet subscribed in my channel, just click the link below or click the like, share, and subscribe button. Or I got that mixed. So click the like, share, and subscribe, and don't forget to hit the notification bell. So you're gonna be updated on my next videos regarding surgical, and it's a prayer time. So I need to be quick. Okay, guys. See you later. Bye. Okay, guys. Now we are here in the instruments for the delivery set or reset. Basically, look like the dressing forceps. It doesn't have a tooth. And then tissue forceps, which this one is called grows or grip, for it's a heavy bony tissue forceps. It has tooth. The difference of the tissue and dressing is that this one doesn't have a tooth. This one, the dressing, doesn't have a tooth, and the tissue forceps has a tooth. If you can see that. Yes, there. So 2:3. 2:1. Sorry. 2. Okay. So now is the needle holder that the doctor's gonna use for suturing. Of course, we're going to check if it has still remaining blood stains, or even though it's after getting out in the automatic washer cleaner. And after that, this the Caesar, Mayo Caesar. This is what it looks like, the Mayo Caesar. So there's a lot of instruments, and this is the straight Caesars, Mayo Caesar, and this one is the curved one. So you can encounter, if you are in this type of field, nursing, you can encounter a lot of these instruments like the curve, the straights, artery forceps, Spencer Wells straight, this one. So we just classify just for the beginners, so they can identify it's artery straight, but they have a lot of different names if you're going to go further on this field. And this is the PN, the Spencer Wells artery curve. And there's a lot of sizes: small, short, medium, depends. So there's a lot of instruments. And this is the Forrester sponge forceps. There's a 2 kinds here, so a different kinds of sponge forceps, but basically their function is the same. So it's just, that's my job, is to make sure there's no other bloods or any bioburdens inside and in between the rachets. This is the box lock. So this is the serrated. So there's no, meaning it has passed the cleaning of, this is the same vaginal speculum. This is for the labor, and this is the kidney basin though. And I'm going to prepare this one. So guys, here, after going to be set like that, and you can see that there's a chemical indicator like this, so that the nurse or the doctor can see if this one has been past the parameters of the sterilization. If this color turns into black only until here, and it is rejected, but it has a straight black line until here, it is passed or accepted. So this is what the LND or delivery set is going to be packed. I'm going to pack this in paper drape. It's the same like this one. So see you again guys after packing this one. Hold on. Now here, sorry for my penmanship. Okay, so it's now packed just like that. And this autoclave tape, once it passed the sterilization process, you can see here like stripes, black stripes, lines once it passed. So the nurse or the doctors will see this set. If it has stripes already, they know it has gone through the sterilization process, and then when they open it, they will see the internal indicator like this. If this one passed also, now they can use it, safe for the patient. Again, so I'm going to move on to the next, so stay tuned. Now we're back guys. This one is for the Cesarean section set, or Cesarean set. I'm going to have a rundown of the instruments for this one. Okay, so first we're going to have scalpel blade holder number 4. So the doctor's preferred, it is number 4. And then again we have the tissue forceps, the bony tissue forceps. It has tooths. So, and then we have the dressing forceps. Again, there is smaller size, bigger size. Okay, and then we have the Adson toothed forceps, a tissue forceps. So this one a different kind of tissue forceps, the family of tissue forceps. So again, there has two. And then we have the scissors again, the straight and the curve, the male scissor. We have a lot of scissors. Also now we have the Metz, the long one. So it has a different type of scissor. This one is a curve, Metzenbaum curve. Then we have the Mayo Hager needle holder. This is for suturing. The needle will gonna be here, and this is gonna be suturing for the patient. So guys, this is the one that the doctor always use. So anyways, this has a golden handle, so it has a different grip. So if you can see, this one has a different grip on it. It's like a tungsten carbide, much better holding of the needles. So that's why it has a gold handle, tungsten carbide. If you want to learn more, just Google it guys. So this one also for Alice tissue forceps, 4 pieces. That's the doctor's he would like. Again, they were going to check its visibility of dirt. This one is the Spencer Wells straight forceps. This one is the Cocker tissue forceps, straight one. We have also a curved one like this, but we remove it in this set. Now this is the Kelly artery straight, Kelly artery forceps curve. So earlier there's artery only, that's why we identify them only as artery, straight or curve, because there's a lot of their names. It depends on their sizes. So this is the green Armitage uterine forceps. Again, you'll check for the visibility of dirts if there is still remaining after the washer cycle, just to make sure. This one knows the sponge, the Forster sponge forceps, checking all the visibility if there's still remaining dirts. This is the Babcock towel, or Babcock? Am I right? Back hose towel clip. Babcock. That's a different forceps. The Babcock. It's like an Alice forceps, but this one is the back hose towel clips. So this one is sharp, so careful. We have the suction pool, wherein the doctor's gonna get the dirt, the bloods or the waters that's upon the operation going on. And this is the Morris retractor, where like the skin is going to be removed if you're going to move something in the skin like that. So this is very useful, that's why it has a handle like here. And this one is the Doyen retractor. Basically, if it is like if it has something like a fat that's bigger, so you need to hold it, because this one, you see. And we have the Army Navy retractor. So there's two pieces that they like. It's like a smaller retractor. And then the galley pot. And then we have the two kidney basins. So basically, this is the doctor's preference for the CS section. So guys, I'll be going to do some of this again later. I go for the minor surgery set. So stay tuned, guys. Don't go anywhere else, and don't forget to subscribe my channel to learn more about the surgical instruments. Okay. And now, guys, here is the minor set for general surgery. So minor set. We're going to have a quick rundown of the instruments they're using. Scalpel blade holder, number 3 and number 4. Okay. Checking for visibility soil. Then the standard forceps dressing, standard dressing forceps. There's 2 of them. 2. Checking it. It's clear. So it has a sizes, different names. Then Adson forceps. There's a Adson forceps, Adson like this. And there's a tooth and non-tooth. I don't know if you can see it, but the tooth ones. See? I don't know. Yes, it's a fine tooth, so I cannot see. I don't know if you can see it like that. What you call it? See? There you go. Let's see. Okay. Now the Metzenbaum curve Caesar. Here we have a smaller Metzenbaum Caesar. This is the Herb Metz. Okay, it's shiny and clean. And then we have the Mayo Caesars, standard Mayo Caesar, gold handle. It's duro or sharp, super sharp. So this standard Caesar curve, and this is the Mayo Caesar. Okay, straight. The difference, this one and the Mayo Caesar curve, this is the Mayo Caesar, this is the standard Caesar. The one with the triangle, that's called the standard Caesar. The tip one is circled, is like a Mayo Caesar, Mayo Caesar. So that's it. Now the Mayo Hager needle holders. So we have 3 different flower sizes: small, medium, and large. So if you can see, it's different sizes. We're gonna check if it has passed the cleaning of the washer. And then we have the Kelly artery forceps curve. Okay, Kelly artery forceps curve. So we have Kelly artery, the smaller. Now we have the Pian artery forceps curve. So it's much bigger than, see, once it has different size, it will gonna be a different names. And we have here the suction pole for the pull section. We're gonna check it like this. So we're gonna drain the blood if it has. We're gonna check for this one, visibility of the dirt. This is the Young Cower section pull. Okay. And there's the Army Navy 2-piece, 1 kidney basin, and then the Alice forceps, Alice tissue forceps. We're gonna be quick now. The Babcock, this is the one that Babcock tissue forceps, tensional clamp, like that. I don't know if this one is Babcock. And this has the Cocker straight forceps. I told you before that we have a curve, Cocker, and this is the curve, the Cocker curve. We have the curve and the straight. Same. Okay. And then again, the back has towel clips. This one is sharp, just to hold the towels in place where the surgery is going on. The Forster Spanish forceps. The Lagenbeck and the Richardson. Again, Richardson, Lagenbeck, and Kelly. All right. Now that's the set of minor surgery. Okay, so stay for a while as I have the major set and the Chole set. Okay, hold on. Hi guys, now we're here for the major set. This is 93 pieces of instruments, and it's normally being used for like general surgeries or OB surgeries like that, because this one is big one. So let's start. So Laney tissue forceps. So this one. So it's like forceps that has a hole. Can you see it clearly, guys? Okay, so that's it. And then the dressing sets that have 3 different sizes. Where is it? Here, the small, the medium, and the large. But right now I think it's the same size because this one is just new. The doctor just requested for additional set, so that's why that it has a sticker, so we can identify it when it's gonna be mixed to a different set. So now moving forward for the tissue forceps, here again there should be a different sizes, but since we don't have much that one of that size, this tissue forceps can do. But the other sets have complete already. This is just an additional set, so no problem. They just do it. They just used this earlier. But this one is the Nelson tissue forceps. The Nelson. It's a bigger one, and then it's like a hands like that. Okay. And then this is the Gillies tissue forceps. Okay, this heavy one. This is the heavy forceps, tissue forceps. So Gillies, if I'm not mistaken. Here, and the blade number 7. Here, it was covered already, but that is the number 804. And this one is the blade handle 07. See the name and the size is 7. The code is this one 07. The last 2 digits is the size. So this additional information to you guys. Once it's not clean, you could not start sterilizing it. All the process will gonna be discarded. It's void. Not now. Now moving forward, Myka scissor straight. Where is it? Here, straight. Again, the straight. Okay. And then standard scissor curve. Here, the scissor. Once it has like a triangle piece. This one triangle. It's a standard scissor. So like that. So this one is a metal. It is not a dirt. It's what you call this? It's from the metal. It's come already, so it's not a dirt. It's the metal itself. So now the Metsumbum scissors. Where it is here. Here, Mets curve. Okay. The baby cocker forceps. See, this baby, because it's like a tiny one, but it has a tweet on the top. This one, the 2 and 1. Let's see, yeah, this one, Kelly artery curve 6, and then 2 PN curve. This is the 2 PN curve, artery forceps again, and then 8 Alice forceps. The 8 ones. 2, 4, 7, 8. Okay. So it's clean. Checking for remaining particles. So this is Babcock tissue forceps, 2 short and 4 long. So this is Babcock, short ones, Babcock. Intestinal tissue forceps. It's a long one. See, it has a small sizes. So welcome. Next will be the Leahy right angle clamp, 5 pieces. So this is the Leahy. There it is. It's a different angle. It's like the right angle. Yeah, because that's the name, Leahy right angle forceps. Yeah, so it's long. So because it's for general surgery and it's for major surgeries, so it should have to be long because it is deeper that they will go access inside the patient's body. Now where are we at? Cocker straight. Here is the cocker straight. Like we have a baby cocker curve, right? This is long, and we like to see the baby cocker curve. See, that's the baby cocker. This is the straight cocker. Curve, cocker. Okay, cocker, like that. Curve. See the difference? See, there's the curve. Okay. And then the mixture curve. This is the small mixture right angle forceps. And then Robert's forceps. Where's the Roberts? Here. Where's the other one? Here. This one. That's the Robert forceps is like the big PN forceps. See, the PN is just like this one. See, PN and Roberts. So this has different names, but they are curved artery. Haney forceps. So it has like a cocker but in the middle, and then there's this like serrated stripes one. Okay, so needle holder. So we have small, big, and large. See how big it is when you're going to have a deep section, major surgery like inside your body. They need to have a big, or suturing, like they're going to like that, the doctors like that. I don't know. Just watching some films. So yeah, that's how it goes. Now back has towel clips here, 5 ones, just to make sure nothing is in between those box locks. This is the box locks. This is the rachet, the handles. Okay, so you know that guys already. So this is just like a random Legend back retractor here. The Legend back Beaver, Morris, Richardson, Legend back retractor. Okay. So these are the ones that you need to open up if you're going to hold inside like that. You're going to open it with 2 hands or the chest cavity like that. So it should be like opening like this, like that. So you're going to, if there is something you need to open it wide, so that's what's going on. Okay, and then what else? The suction tube. Yankauer suction tube. This one, the Yankauer, and this is, yes, the suction pull suction, or suction pull suction. This one, 2 pieces pull. So you need to pull now. P-O-O-L-E, pull, which suction, the Yankawa section, and then what else? Sponge forcer. This is the intestinal clamps. See, intestinal clamps. Maybe when your intestines, you need to hold it like that, so it is flat, just to make sure your intestine will not gonna be damaged. That's the intestinal vascular clamp. And then again, the sponge, the Forester sponge holder, the kidney base. Basically that's it. So guys, thank you, and I'll be giving you the Chole set later. Hold on guys, bye. Hey guys, now this is the Chole set for general surgery, or for OB, or general surgery. Normally they use this for minimal invasive procedure. So if you don't know, just Google it guys, so, because it will give you a lot of confusion. But anyways, for the medical fields, they know it already, like the nurses and or staff, operation rooms, they know this one. So this is the Chole scissors. There's the claw or go Maryland fenestrated forceps. This is the curve Maryland, and then another scissor, fenestrated Maryland forceps, and the grasping forceps. So in case you don't know, we have also the electrode hook, wherein they're going to put a hole inside the patient body like that, and there's going to see like this, right? So if you will be like that, so the patient, we're just gonna be mixing it like that. This is the hole, so the doctor, we're just going to see it on the camera, so they will not going to slice you up to open you up, but they're just gonna put some hole, a small hole, so that these instruments can be inserted, and so you can be operated like if you're going to have gastric that of what else, but like any minimal invasive procedure. So it's gonna be less less cuts, or less open, only holes, so it's easier to heal. And then the new nurses, and they're going to use this open. We have only the metal one for heavy instruments, heavy, that they would, it's okay. So that's why there is a thick one, and there's a thin one. So you can see, you can check that there is a thin thick one on their heads, on their neck. You can see that. See, this one will be inserted a thick, and this one is a thinner one. So that's why. And then I'm going to show you. So when you're going to remove it, just press this button, and then a little pressure, and then when going to attach again, just like that. Just don't open this one, let it flow inside. Like, see, it's easy now. Yeah, like that. Okay, it's locked. I never push it down, it will automatic put on their way. See, okay. Now I'm going to set this one and put it in the sterilizer or in an autoclave. Okay, now guys, we're back, and I'm going to start now. So this one is heavy. You have to start sterilizing all the sets that I have packed inside the autoclave. This is a double door Getinge autoclave, so it's an automatic sensor. So this is the receipt or the papers that has the different informations wherein the sterilizing, vacuum drying, and all the phases of this load. So we're going to start it now, and okay, start program. So you can see there, it's normally 30 minutes on the just for now. And yes, this is Myka TV. If you're not yet subscribed to my channel. Okay guys, see you again. Goodbye.